Hi everyone, I'm Dr. Emily Carter, and in today's video, I'm going to walk you through 5 essential care practices every man should follow to ensure optimal penile and sexual health. And for those of you who stay until the end, I'll also share a 6th tip as a bonus, one that's often overlooked but clinically relevant. These 5 recommendations essentially summarize what every man should be doing to reduce the risk of sexually transmitted infections, penile cancer, erectile dysfunction, and Peyronie's disease. By incorporating them into your routine, you'll be taking significant steps toward protecting and improving your sexual health. First tip, keep the penis active. Avoid disuse. This principle, gentlemen, applies to virtually every organ in the human body. The penis, much like the brain or any muscle group, requires consistent oxygenation to maintain its function. Adequate blood flow is essential for tissue health and erectile capacity. And let me be clear, we're not exclusively discussing sexual activity or masturbation here. For patients who may not engage in regular sexual activity for various reasons, there are clinical alternatives. A vacuum erection device or pelvic floor physiotherapy can help stimulate blood flow and maintain tissue integrity. However, for most men, a healthy and consistent sexual life remains the most natural way to prevent disuse atrophy and preserve genital function over time. Second tip, personal hygiene. This may seem self-evident, but from a clinical standpoint, it cannot be overstated. Proper penile hygiene is absolutely critical. In countries like Brazil, for instance, penile cancer rates remain alarmingly high, and the primary risk factor is inadequate hygiene. I recommend cleansing the area daily with a mild, neutral soap. Glycerin-based options work well, followed by thorough drying to prevent moisture buildup and bacterial or fungal growth. Another often neglected practice is washing the penis after sexual intercourse. The vaginal pH differs from that of the penile skin, and exposure can alter the local microbiome, potentially leading to irritation or infection. Third tip, be cautious with intercourse during partial erection. This is something many men don't consider, but it's medically significant. Engaging in penetrative intercourse when the penis is only semi-erect increases the risk of repeated microtrauma. Over time, these small injuries can lead to the formation of fibrous nodules within the penile tissue. This fibrosis is the underlying mechanism behind Peyronie's disease, a condition characterized by abnormal curvature of the penis that can cause pain and functional impairment. So, if you're not achieving a full erection, it's better to pause and address the underlying cause, rather than proceed and risk long-term damage. Fourth tip, limit excessive pornography consumption. This is a topic I discuss frequently with my patients. Overconsumption of pornography can lead to what we call sexual desensitization. The brain becomes conditioned to respond primarily to the specific visual and masturbatory stimuli provided by pornographic content. As a result, arousal and performance during real-life intimate encounters can become significantly impaired. This isn't about moral judgment. It's about neurological and psychological health. Moderation is key, and if you're noticing a disconnect between your response to pornography and your response to a real partner, it may be time to reassess your habits. Fifth tip, prioritize healthy lifestyle habits. This is perhaps the most foundational recommendation I can offer. Sexual health is not an isolated system. It is deeply interconnected with your overall physical and mental well-being. Diet, hydration, sleep, stress management, all of these factors influence erectile function and libido, and certain habits carry specific risks. Smoking, for example, is a well-documented risk factor for both erectile dysfunction and Peyronie's disease due to its impact on vascular health. Excessive alcohol consumption similarly impairs sexual performance. The lifestyle choices you make today will directly shape your sexual health for years to come. Prevention is always more effective than treatment. Now, before I share the bonus tip, I want to mention something that may complement everything we've discussed today. There's a natural 7-second home method that has helped over 60,000 men restore youthful desire, firmness, and potency without medications or drastic lifestyle changes. If you're interested, point your phone's camera at the QR code on screen or click the link pinned in the first comment to learn more. It could be the missing piece in truly optimizing your intimate health. Now, the bonus tip, and this one surprises many of my patients. Develop the habit of sleeping without underwear, or at the very least in loose-fitting boxers. Here's the clinical reasoning. During sleep, men experience multiple nocturnal erections. This is a normal physiological process. Tight underwear can compress the erect penis, causing repeated low-grade trauma throughout the night. Over time, this can contribute to localized fibrosis and eventually penile curvature consistent with Peyronie's disease. It's a simple adjustment, but one that can have meaningful protective benefits over the long term. So there you have it, 5 essential practices plus 1 bonus recommendation for maintaining a healthy sexual life. These aren't complicated interventions, but they are clinically significant. If you found this information valuable, please like this video and share it with others who might benefit. Feel free to leave your questions in the comments below. I read them and do my best to respond. Thank you for watching, and I'll see you in the next video. Take care of yourselves, gentlemen.